authority. Models are starting to carry them because it's being shown that they're great for core stability. It provides a compliant surface for us to work on, which again can give us a way of mimicking the adjustments we have to make in our riding. So what I'd like to do is I'm going to demonstrate some exercises for you guys. And I just need to make a quick disclaimer that, again, before you guys start any of these exercises or want to try them, again, see your physician, make sure you're healthy enough and you don't have any underlying issues that could cause problems from these exercises. So what I'd like to do is I'd like to demonstrate a few myself for you guys. Okay? So I'd like to take maybe 2 or 3. I'll go here first.
I'm interested in you were talking about the core and the muscles that we normally don't work, like when you do crunches or whatever.
Yes.
I'd like to know what exercises you should do.
Should do for that?
Yeah.
Okay, very good. So that will be the first one I do. Anything else? Well, everybody wants to know about the core.
The quads.
Quads? Okay. Quads and pecs? Okay. All right, so let's start. I'm going to do pecs first because I want to talk about a stretch because we talked about stretching for the pecs. All right? So these muscle fibers go from our sternum out to our shoulders, okay? There's muscle fibers that run in different directions. They're not all just straight across. So different angles of the stretch can be appropriate. So you're standing in your barn. You have the stall door open. Actually, I'll pretend this is the stall door. Arm up. Again, ear, shoulder, hip, proper posture. Just take a lunge step. You're going to feel immediately a nice opening across the chest. Again, arm out to the side. Again, a different direction or orientation of the fibers, and even arm down. And again, I like doing this kind of lunge step. Too many times I see people kind of just hanging or leaning on their shoulders, and it actually can injure the shoulder joint itself. But again, maintaining where you want your posture to be and stretching that out can help. And again, doing one arm at a time. Again, some of us might be tighter. This might be our mouse arm at work, or the arm that we drive with. So little things like that you actually will feel when you break it down and do one side versus the other instead of just, again, a normal two-sided stretch. Okay? So like I said, talk to your doctor, make sure you're okay to do these things before you go. Okay, so we did pecs, quads, and then I'll get to the core. Okay? So quadriceps, really we want endurance for them. Okay? When you think to the gym, you think of the machines where you sit and you do those long kickouts. All right? They're okay, but it doesn't actually mimic what our sport has to do. So what I would recommend is a sustained squat. I'm not wearing heels for this. I thought I needed to be a little bit taller, so I decided to wear this. But can you guys see if I'm over in this corner? Is that okay? All right, so even just getting into a squat position, folding at our hip and our knees, and doing some other exercise while we're doing it, you're going to start to feel the burn. So even just take, this is a medicine ball, it's about 2 pounds, but even just a dumbbell, and just doing basic arm lifts, or just passing the ball side to side, I'm already starting to feel my quadriceps kicking in, okay? So doing something like that. Or again, the good old-fashioned wall sit. Come down, sit, talk on your phone, or check your BlackBerry, something like that. You're going to get that co-contraction of the hamstrings and the quadriceps in a more functional position because our foot is in contact with the ground, as compared to the old-fashioned just kind of kick-outs, where again, we're just focusing on one muscle group instead of getting multiple ones kicking in. The wall's good, but again, if you can take it off the wall, that's even better. Okay? The way to contract that deep abdominal muscle is imagine pulling your belly button to your spine. So as I'm doing that, and I'm wobbling and having to adjust, we're getting these front to back perturbations that we're adjusting to. And again, over a long period of time. Time yourself when you do these instead of just say, okay, I'm going to do it for 10 seconds. Go for 30. When 30 is easy, go for 45. 45, go for a minute. You can even side to side. So we're getting that side to side. Again, pulling my belly button to my spine. I'm sorry, you can't see. That was your question. So side to side balancing. And again, if you want to challenge yourself, do some rows. Have somebody holding an exercise band. We're getting all the contraction of these muscles. You can see even here the side to side. What group were we talking about? Those glute muscles that help adjusting side to side in the saddle. So it's very easy. Again, you guys, I actually keep this in my living room because, again, I can't really tell people to do exercises and not do something on my own. but what I like to do is I tell people, I call them commercial exercises. All right, we all like to watch maybe a little bit of TV at night before we go to bed or in the morning. Do them during commercials. There you get 30 seconds to a minute and a half to do one exercise at a time. Again, have a TheraBand tied around your doorknob, and you can be doing repeated rows. All right? Or again, in that squat position. It's very easy just to kind of, again, do these around the house, even have some tied up in the barn. You guys can kind of talk and share, and if you find one that helps, share with a friend and be like, hey, this is something that I did, or oh yeah, you're tight, this is a stretch. Because it's not like you have to have big fancy equipment to do this. Bicep curls, some delt raises, again, have somebody holding a tube. You can march, again, that's side to side.
That's harder than
stability. Oh, it's, yeah.
Yeah.
Opposite arm and leg. Yeah, I don't practice these every day. But again, I'm pulling my belly button to the spine. I'm recruiting these muscles again, and it's going to give more. Can you say? More endurance. This, I wanted to actually show it on somebody, and again, I apologize, guys. My license for PT is in Maryland, and since we're in Virginia, I can't have you guys participate in anything without signing all these waivers and stuff like that. So I'll do it in the middle of the room, because it actually is
Yeah, okay, that's fine.
You're a PT in Virginia. Do you know the foam roller? That had
No, but I can be your student if you were to suggest.
Okay. All right. Okay, so you understand kind of where I'm coming with this and license in Maryland. Okay, so we're all talking about the tightness in our chest and the lack of flexibility in the shoulders. So what I'm going to ask you to do is go ahead and just lay on the floor. It's a little odd. All right, so you're going to sit on the foam roller, okay, and you're going to lay on back, so it's right along your spine. So be sure your tailbone and your head's on there. Knees can stay bent, hands are at your side. All right, and what we're going to do for 2 minutes, you're just going to massage back and forth. Just roll. This is more of a stretch. This isn't as much of an exercise. You can do stuff on the foam roller.
Can you get the roller?
Try to keep your hips parallel.
You can get
so you're going all the way across and across.
You can get one of those at like Sports Authority.
You can buy them at Sports. They're more expensive at Sports Authority. They're like $30-some, but just go online and go to foam roller, and they're like $16. Okay. Foam rollers. Just Google foam roller, and you'll see them. Again, don't get them at Michael's. I've had patients that try to get them there, and that's the foam that crushes. I was like, so I think I need to buy one of yours. I was like, sorry. So, all right, we've already done about 45 seconds. Just keep rolling back and forth. I've got you timed. We'll do 2 minutes. And 2 minutes is actually a time that they found that it takes the brain to recognize something has changed in the body. Okay? So.
That's pretty cool.
Yeah. All right, go ahead and pause right in the middle. What I want you to do is take your arms and you're going to reach back overhead, gently let them try to fall to the carpet. Good. And then bring them back down to your hips. And do that 10 times for me. So here we're really actually opening up the rib cage. Again, getting the shoulder blades opened up. So do that 10 times. And I actually will use this on a lot of my shoulder patients, not obviously right after surgery, but as we're dealing with those last few degrees of range of motion. Because again, getting a little bit up off the floor adds an area to a range that we can't get otherwise. So when you're done 10, let me know.
Well,
Okay.
I have to tell you, I
Yeah.
did physical therapy last year on my shoulder, and my riding suddenly improved. And I told my physical therapist, "You should go do this.
Right.
For riders."
So I love it.
That whole, I never felt that concept. Of
Yep.
having that open chest and getting your
Because we get so used to just kind of being like this. Yep. Arms straight up to the ceiling, and then out to the side, and do 10. So here we're again stretching that pec through. And most people don't. I hear that. But I think it's one of the things we know. I compare this for my patients to like brushing your teeth. You brush your teeth for 2 minutes to prevent cavities. If you can find 5 minutes to do a couple stretches, you're going to help prevent yourself from injuries. It's more proactive care than having to be reactive. Roll off back onto the carpet and lay flat again like you did at the very beginning. And describe what you feel.
That it's a whole workout because you have to stabilize your body over a dynamic surface.
Exactly.
So even though I'm moving my arms, I can
Yep.
really feel my stomach keeping me because you have to stay on the foam.
Exactly. And I actually see a change right here in your shoulders. You have probably about 2 inches of just kind of elevation here when you first lay down. And you've opened up your chest and you have more surface area of the scapulas against the floor. Now this is like what our ideal posture. If we lived in a perfect world and again we had all the mobility, we would be able to lay down and feel like that because our body would just adjust to the contours of the floor. But again, doing this, it allowed this opening and stretching of the chest, again, the stretching, the opening of the shoulders, and then there our body comes to what a natural posture position is compared to what our day in and day out type activities are. Thank you very much. I appreciate that.